Here we go.
Oh,
Hello.
hello. Cool. Okay. Hi
I,
there.
hello. I know it's always sort of hilarious just getting this going, right?
It always is. And we post the recording, and it's always a minute of me just kind of spitting,
I
like,
know.
hi.
I like your idea of the music. That would be, you guys should have like a theme song.
Yeah, we should. We should get a Science Up First theme
You
song.
totally should, where it's like do the science matters.
Well, put it down. Put it down for next time.
Well, I'm prepared for our coffee. I've got your coffee mug,
Amazing.
right?
Oh, I don't know where mine went. I had it last time, and I put it down somewhere, and I honestly
Oh
don't know
no.
where I put it. Anyways, hello everybody, and welcome to Coffee Up First. I'm Sophia. I'm the content producer for Science Up First. I'm very excited to have a special National Immunization Awareness Week session. Before we get rolling, I want to start with a land acknowledgement. So today I'm joining you from Toronto, which is located on the traditional territories of many First Nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and which is now home to many diverse First Nations, Inuit, and Métis peoples. I encourage everybody, wherever you're joining us from, to also take a moment to reflect on the traditional territories that you're currently located on, as well as reflecting on how you can otherwise incorporate reconciliation into your day-to-day. So today I am joined by the super cool, very exciting Dr. Katharine Smart. She is the president of the Canadian Medical Association. She is a pediatrician and she's a mom, also important to add on. So thanks so much for joining us today, Dr. Smart.
Thanks for having me. And my one request is, can you tell my kids that I'm super cool?
I will. I will. You
Okay,
can show them
perfect.
this clip. Your
Okay,
mom's
great.
awesome.
Yeah, I'm gonna get them to text you later.
Okay, sounds good. So I've got some questions for Dr. Smart, but there's a little Q&A box at the bottom as well. So if you have questions for her, you can pop them in there. And if we have time, if I can refrain myself from asking all of the questions, then we can see if we can get around to some audience ones as well. So just to start off, kind of nice and easy, when you meet somebody new, how do you explain what you do to them?
That's a great question, and I guess it would depend on what they were looking for. If they want to know what I do professionally, I think how I identify most is as a pediatrician. I've been in pediatrics now for over 20 years, caring for kids, and it's a huge part of my worldview, and I've had a huge amount of learning in that job. So I think I would, want people to understand that about me. And in this past few months, I've also had the privilege of serving as the president of the Canadian Medical Association, which has been really interesting also. But I think a lot of my experiences as a pediatrician and working with kids and families has really informed sort of my approach to this role I have currently with the CMA.
Yeah, and so you say you've been a pediatrician for quite a while, and for a
Mm-hmm.
couple months the president of the CMA. So how did you get into this, the field of pediatrics and your involvement with the CMA?
Yeah, so when I was a medical student, of course, medical school is really about figuring out what specialty of medicine you want to do. And I always thought I was quite interested in child health. And I had the opportunity to spend 2 summers in South Africa at the Red Cross Children's Hospital there when I was a medical student. I was actually doing some research on pediatric HIV at the time. And it was fascinating just seeing the kids and very different than Canada in terms of the disease burden and the types of things I was seeing, and it really got me interested in that area of medicine. I love children. I love the range of medical things in pediatrics. It's everything from premature babies to teenagers. I love the people in pediatrics. Most people who work in child health are there because they really care deeply about children and families. So I really like that atmosphere. And then the opportunity for the CMA role really came. It was that role rotates around the country, and it was the Yukon's turn to have the president. So since for me, a huge part of what I love about child health is advocacy, I felt that this was a chance to really be able to do that with a national platform. So I put my name in the election and I won. So here I am.
Yeah, that's really great. And so you're obviously very passionate about all of the things that you do, but if you had to pick a favorite part of any of your jobs, what would it be? What's your favorite thing to do?
Well, I've done many things in pediatrics over my career, from emergency medicine to transport medicine to what I'm doing now, which is working in Canada's north. And I think the thing that means the most to me is the work I've been able to do here in the community. What's really, I think, exciting about our program is the partnerships we've built with the community in Whitehorse and with the First Nation citizens, and the learning that's happened from that for myself personally. And the ability to really try to create comprehensive services for children, including preventative services, and linking with people who know kids and families to get their feedback on what we can do that's actually useful and helpful, and seeing some of that come to fruition with different programs and interventions and funding streams that are really supporting kids and families to be together and be healthy. That's probably what I've enjoyed the most.
Yeah. And is there something kind of like up and coming, moving and shaking in your field that you're like really excited about that you want to let people know about?
Yeah, well, it's interesting because what I find at this point in my career, what really interests me a lot about health and science is sort of, how we end up in these places that we end up in, right? So I think the pandemic has been a really interesting sort of look into where are we at with science? How is it intersecting kind of with our popular culture, with the mindset of people, with the way we work as a community? And I think one of the biggest challenges of the pandemic has been communication. So what I've gotten really interested in lately is research looking at information, how people consume information, how we communicate, the role of social media, misinformation in terms of how it drives the decisions people make. And what I've been really interested in the last few months is all the studies that are coming out that are really showing the prevalence of misinformation or disinformation on platforms like social media. So it's really made me reflect on the importance of moments like this that we're having together to really try to communicate with, in my case, kids and families and youth, to help counter some of those narratives that aren't actually based in fact, because I think they're having a huge impact on the health of our population. I think they're going to have a huge impact down the road. And I think it's really important that people are aware of how prevalent this problem is. And we, as the experts or the people in this field, I think need to really be reconsidering what our roles are. Because if we're not there kind of participating in this, I worry that space is filled with other people. And unfortunately, they're not always people that are sharing accurate information.
Yeah, I can say Science at First, definitely glad to talk about misinformation research
Totally.
all the time.
Yeah.
Um,
No, and your work has been so important, right? Because I think you're really bringing this research forward to people so they can be informed. Because we tend to kind of, believe what people are telling us is true. And I think your organization's been really great at making Canadians realize, hey, I've got to be really careful how I look at this information and where it's coming from.
Yeah, well, exactly. And on that note, I kind of, dropped the National Immunization Awareness Week name when we started this. But for people who aren't aware, right now we're doing kind of, it's like a national campaign, but we're doing like a myth busting week on routine immunizations.
Mm-hmm.
And so for people who aren't aware, can you explain what National Immunization Awareness Week is and why it's important?
Yeah, for sure. So, as you said, it's a week that's really focused on trying to remind people about the importance of vaccination and what a profound public health program it's been and the impact it's had in our country and around the world in terms of saving lives and improving people's lives and preventing death and disability. I think it's really there to kind of get this issue forefront in people's minds again so that we're not forgetting about it. I think what's amazing about vaccines, right, is they're kind of quietly doing their work in the background, and over 50, 100 years, they've completely changed the face of health and healthcare, but they're doing it in such a subtle way that it's easy to kind of forget what the world was like before we had vaccines. And all you need to do is talk to a pediatrician who's, 20 years ahead of me in pediatrics and ask them what their practice was like, let alone, back 80, 100 years ago when children and adults were dying from what are now preventable diseases that we don't even think about. So I think this week is really to get us talking about that again, to remind people and to not get complacent, because I think that's the risk, right? When you don't see these things, you forget about them. People don't really realize the threat they can still pose. And that complacency can lead to us falling behind. And unfortunately, that's, I think, one of the really scary things about the pandemic is we know 1 in 4 kids has fallen behind on their routine vaccines. And that is putting a lot of kids at risk. So I think weeks like this to really get talking about it, to have these opportunities so people can be more aware and making sure that they're getting their kids in for those appointments is really important.
Yeah, and I gotta say, when I saw that number that like 25% of kids in Canada have fallen behind on their routine immunizations, I was like really shocked by that.
Yeah.
Um, and so I know when we were trying to brainstorm like things to post about this week, misinformation about routine immunizations, there's a lot, like there's a lot out there for us to cover. So for you, in your experience, what have been some of like the most common misunderstandings about routine vaccinations?
Yeah, it's a great question. And I think there's a few things that I hear commonly as a pediatrician from parents who aren't sure. I think, it falls into a few categories. One, I think, is concern about the immune system. So a lot of parents have sort of heard this messaging that the routine childhood immunization schedule is overwhelming for their child's immune system, and it's too many vaccines too close together, and that's going to cause some issues with their immune system. So that's a real common concern that I hear. And that leads to people thinking it's a good idea to space out vaccines or give them on a different schedule. So it's often really helping parents understand how powerful our immune systems are, and that these vaccines are such a small bit of antigen, meaning stimulus to the immune system, that your child would encounter even just in a single day of being out in the community, that there's really no issue with that happening. But that's one narrative. I think the other big narrative that's been really unfortunate is that attempt to link autism to the MMR vaccine, and that did a lot of damage. And that's another thing that still comes up a lot, even though it's been totally debunked. That physician that did that work has lost their medical license. It's clearly not true. That narrative resurfaces a lot, and it's had a lot of play publicly. And again, I think it's an example. Autism is obviously a really complex neurodevelopmental disease that we don't totally understand. We know there's lots of different things that cause that, and I think it's pretty understandable for families that are dealing with that diagnosis. You're sort of looking for why. And I think sometimes when we don't always have answers, other things fill that void of the potential why, even though in this case that's totally being debunked. So that's a common one that I hear. And then I think for some parents too, it's what the other thing I've really noticed is I think a lot of people just don't have any experience with these diseases because we don't really see them anymore because of vaccine. So I think sometimes it's hard for parents to, in their mind, rate what they perceive as the potential small risk of the vaccination against this risk of these diseases they're really not familiar with. They don't have like their friends and neighbors having experienced this when they look out in their community and are not seeing these diseases. So I think often they get quite stressed thinking, well, what if, some rare crazy thing happens to my child, and really I don't feel they're really at risk of this. So there's that challenge of sort of making a proactive decision versus just sort of passively sitting back and thinking, oh, I think it'll be okay. So I think some people get stuck there a little bit with, decision fatigue, and then they just end up not acting. So those are, there's several things that we hear. Those are the common ones. The other one I'd say that's come up a lot that again has been debunked is what are the preservatives in vaccines? There's a lot of narrative around things like mercury and other things that aren't in vaccines, that people are worried about. So sometimes people have heard very specific things that they come in about, but more broadly, I think those first three things are said are what I commonly hear.
Yeah, I think that's a really good overview, and it is interesting how different pieces of misinformation stick in people's heads, and
Yes.
like come from these different sources. But I guess at the very base of it, when people are deciding, or thinking about like, oh, there's benefits versus risks of vaccination, just like in general, why are vaccines important? Like why do we get vaccinated?
Vaccines, in my mind, are one of the two most incredible and important medical or scientific discoveries, inventions, instruments that we've ever had in the history of medicine. There's really two things that have changed the course of human health. One is being able to separate ourselves from our feces through sanitation, water, hand washing, and the second is vaccines. And those two things have literally saved billions of lives, prevented billions of dollars of disability, and allowed children to thrive. In the past, you just walk through a graveyard from 100 years ago, and what do you see? Tombstone after tombstone of children under 5. Those children predominantly died from infectious diseases that now we don't even see anymore. all that death and destruction has been prevented primarily from those two things, vaccination and sanitation. It is the single most important health discovery we've had. It's incredibly safe, it's inexpensive, it's profoundly impactful. So I just think we should never underestimate the power of vaccines. And again, we're seeing it with COVID-19. You know, millions of lives now have been saved from the COVID-19 vaccine. And it's, you know, I think really unfortunate that that hasn't pervaded the whole globe yet. But, you know, we've been very fortunate in the global north to have really what feels like endless access to vaccine. That's not true in the global south, but we are still seeing those vaccines are hugely powerful in preventing bad outcomes from COVID-19. So we're just continue to see the power of leveraging our immune system for what it's able to do through vaccination. And it's just amazing to me, I think, the health outcomes we've had from that.
Yeah, that's a really good answer. First off, second off, I'm glad that you brought up the, you know, COVID-19. It's almost like, ooh, we made it 15 minutes without talking about COVID. Because of course, when you're talking about vaccination now, it is impossible to not also talk about the pandemic. So I'm curious how the COVID-19 pandemic has changed both your work and what the CMA has been doing.
Yeah, so I think, you know, COVID-19, I think really kind of stopped all of us in our tracks 2 years ago and has diverted a huge amount of energy towards the pandemic in various stages, you know. And I think the CMA as an organization has really had to pivot a lot of its attention to this acute crisis and in different ways, in different stages of the pandemic. So I think initially it was really the advocacy and understanding what physicians were dealing with and other healthcare professionals around things like PPE and being able to actually care for patients safely. And those early days when we were in lockdown, you know, making sure doctors and nurses and RTs and other people had what they needed to be able to care for people safely with COVID. And that was a huge dominant problem at the beginning. Then I think, you know, then we had the whole issues of once the vaccines were available, trying to communicate with the public about the importance of it. You know, some of the more controversial things like, should they be mandatory for health workers, vaccine passports, vaccine mandates? We were heavily involved in sort of weighing the ethics around that and speaking out on what we thought what made the most sense and was important for the population. And I think, you know, that recent study that just came out this week in CMAJ that really showed the importance of as many people being vaccinated as possible, and that unvaccinated people do continue to drive case counts and create more risk for people around them, I think shows the importance of those tools in terms of really pushing more people to be vaccinated, not only for their own personal health, but for the health of our communities. And I think that's been a real challenge for us, right? We live in a society that's very individualistic. We tend to value our individual rights over the rights of the community. And I think this pandemic experience has probably made a lot of people really have to reevaluate that value system. So I think for the CMA, you know, we've been wrestling with that issue and trying to come out with the things that we think are important. So that's been interesting. And then, you know, the third piece has really been how the pandemic has laid bare what's going on in our healthcare system and really been the ultimate stress test for a system that we knew was already struggling, but now has truly been, I like to say, sometimes pushed over the cliff in a lot of ways. So a lot of our work now is really intense advocacy with different levels of government to really try to make people understand how at risk the Canadian healthcare system is and how important it is that we continue to both reimagine the system, modernize it, but also invest in it more so that it's there for Canadians. So that's kind of been our advocacy work. For me personally, you know, this past year, I've really, since last August when I became the president, this is now my full-time job. So my clinical work is, I'm doing a little bit of outreach still to some communities, but I'm primarily in this role. So that's been a great opportunity, I think, to try to feel like you can contribute to this crisis we find ourselves in. And I think, you know, for our clinic here in the Yukon, for us, our big focus has been on how do we keep getting kids the care they need despite the pandemic. So in early days, you know, that for us really meant a rapid shift to virtual care. We literally did that overnight in our office so that no one's care was canceled, really making sure that kids had access, trying to make ourselves available, and then providing support. You know, fortunately for children, We haven't seen the same issues with hospitalization, really severe illness that we've seen in adults. So I think our work has been more around making sure kids are getting all that other healthcare they need, addressing all the mental health concerns and other concerns that have arose, really trying to inform our community around the importance of vaccination as that's become available so that we can keep kids safe and out of hospital as we get deeper into these waves. And especially now with Omicron, with so many more people getting infected just because it is so contagious. I think that preventative work is still so important.
Yeah, and so you mentioned in there talking about how the healthcare system, how the pandemic really laid bare the state that like both, across the entire country and in different provinces and territories, these like where these healthcare systems are at. And so are there things that like Canadians can do to help support their healthcare
Mhm.
system?
Yes, absolutely. So I think there's a few things people can do. One is, of course, is listening to what scientists are trying to tell you about being vaccinated, making sure that we redefine fully vaccinated to 3 doses of the vaccine, because the science is very clear on that. For anyone eligible for 3 doses, which is really everybody 12 and up at this point, may eventually include younger children. That third dose is key to keeping that advantage from having severe outcomes. For some of our population, that's going to be a fourth dose. So I think right now the biggest thing you can do to keep the healthcare system protected is to make sure you're fully vaccinated, and that's going to help your community as well. I think, the other thing is to recognize the healthcare workers around you and just thank them for what they've been doing. We went a little bit from heroes to villains over the course of this pandemic. At the beginning, there was a lot of gratitude. And I still believe most Canadians, by far the vast majority, deeply appreciate people in the healthcare system and see their work. But like everything in life, it's that loud minority that gets a lot of attention. And there has unfortunately become a lot of negativity and harassment and a lot of the frustration the public's felt, which is, I also understand why people have been frustrated. This has not been an easy time. But unfortunately, I think some of that has come out directed at healthcare workers. So I think a lot of people in healthcare right now, including doctors, are feeling a bit down. And it's amazing just how powerful a bit of gratitude is, just acknowledging people and thanking them for their work. I know for me personally, the things that have always meant the most to me in my work is that simple handwritten note from a family just saying, the care you gave our family mattered. That's why you do this work, is you want to help people. And when you get that acknowledgement back, it's very powerful. So I don't think your average person should underestimate the value of that. And I don't think it's just people in healthcare. I think it's everyone on the front line, right? The grocery clerk, the person at Canadian Tire, all these people that have been there keeping these services flowing, that extra bit of kindness and acknowledgement, I think goes a long way. And then I think the third thing all of us can do as citizens is use our voice, right? We live in a democracy. We vote for who our governments are. We define through the things we are concerned about what their platforms are going to be and the things they're going to prioritize. And I think we have to keep letting our elected officials know that healthcare has to be at the top of that. There's no one in our country who's not going to need the healthcare system at some point. And we need our governments to know that we want them to work with stakeholders like the CMA and other professional groups to really reimagine that healthcare system so that it's still there for us down the road.
Yeah, it's a great answer. I really like, I think it's always important to talk about like kindness, like
Yeah.
continuing to be kind to the people around you because everybody's having a tough time right
Totally.
now.
It's true. And you know what? I agree with you. Like it's one of those things that sometimes can sound like, oh, is that really that important? But it is. You think about your day. If someone's just nice to you or smiles at you, even if it's from behind their mask, or if you make a mistake and someone's kind about it, we all do things wrong sometimes, but someone gives you some grace or just acknowledges something you've done. That's the difference between a good day and a bad day. And that's a power that all of us have.
Yeah, 100% agree with that. And so I think one of the problems that this pandemic has definitely laid bare is just like a general increase in vaccine hesitancy among
Mhm.
Canadians. And it's not always, like this really social media polarization, angry people, but there are just a lot of people who feel like unsure about
Mhm.
vaccinations. And so what do you think can be done to help reach those people and to help like educate about vaccination before they get to this like polarizing point?
Yeah, I think that's such a good point. And I think unfortunately the polarization has made it challenging for people who are hesitant or just have questions to feel like they can ask them because they're worried about the judgment or or being shamed and sort of put in this group that's maybe this louder extreme group that probably most of us don't relate to quite as much. And I think that's actually been a real issue because we need to be able to communicate to people that it's totally okay to have questions, and you should have questions about vaccines or really anything about your health, and that there's absolutely nothing wrong in asking those questions and wanting information to make decisions. So I think, I think some of our challenge generally in dealing with vaccines is, and I've saw this before, even before COVID with childhood vaccines, is I think because we feel so passionate about it as healthcare professionals, because to us the science is so clear, that I think unfortunately sometimes that passion can be put onto people almost as shaming them into making a decision, right? Like, what's wrong with you that you wouldn't choose this for your child? Or we're sort of belittling their concerns and not maybe purposefully, but leaving them, trying to almost like shame them into doing what we want. And that never works, right? Like no one reacts well to that. None of us react well to that. And I think we need to find those commonalities, and we need, I think, to be more open to acknowledging what it is like to be a person with all this information coming at you and uncertainty. And I think that is the challenge of misinformation, even though it doesn't necessarily push everyone into that polarized camp. It plants enough seeds of doubt in people that they are left hesitant, which means they're left not making a decision. And they can sort of persist in that, oh, I'm just going to wait and see, rather than actually taking the action to choose to be vaccinated. So I think our job is to really meet people with compassion, welcome questions, answer them to the best of our ability, acknowledge that this is normal to be unsure, and it doesn't mean you're a bad human. It doesn't mean you don't love your children. It doesn't mean you don't love your neighbor. It just means that you are barraged with information and you're unclear. And I think we have to have time for those conversations. I think things, creating these public forums for people that maybe don't have a trusted health provider, because we know, over 5 million Canadians don't have a family doctor. So not everyone has a personal relationship with a science expert to be able to go and talk to. So I think creating these types of opportunities so people can listen to trusted experts and hear information is important. And I think we just have to try to bring more people in the tent, right? And give them that information and create a safe space for concern. But also I think we have to be really clear with our communication that this is not science that's really up for dispute, right? It's very clear that vaccines work. They're safe for the routine vaccinations, the COVID-19 vaccine, the benefits far outweigh any small risk. It's just, there's no uncertainty there. But if people have certain questions about things they've heard, I think we have to be able to answer those.
Yeah. Yeah. And you're speaking of answering people's specific questions. I did see an audience question go by.
Sure.
So this one's it is a little bit more specific. This person is asking, how would you talk to a parent who doesn't think their child needs the COVID vaccine because their child has already had COVID?
Yeah, that's a really important question. And I think that extends to children and adults, because now, we just saw a study come out this morning that at least 1 in 3 Canadians has antibodies to COVID. So, that more and more people are getting infected. I think the reason the vaccine is important is the science is really showing us that the longitudinalness, or I guess the longevity is the better word, of your immunity is better if you're also vaccinated. So if you've had COVID and you're vaccinated, you are going to be protected longer than if you've just have immunity from the vaccine or from the natural infection itself. So there's still definitely a benefit to being vaccinated if you've had COVID. So I think that's what I would want to explain to someone is, yeah, totally fair question. And is there some short-term protection from having had the infection? Absolutely. But it doesn't last for months and months. And I think what we all have to remember is, we don't really know what's around the corner in terms of the next variant. And that's something that I often think about. I mean, I think what we're hopeful is that this is sort of the nadir of the pandemic and we do move to it being more endemic and manageable, but we don't know, right? So I think we want to make sure us and our children are protected with all the tools we have right now, so that if something is coming down the road or this isn't going away, that we have given them, prime their immune system in the most powerful way possible to deal with whatever's next. And I think even for those of us who have had COVID, also being vaccinated right now seems to be the combo that does that the best.
Yeah. Well, the Parents Ottawa, there's your answer. Yeah, so it's about time to wrap up. So I'm gonna monopolize the last question because I cannot help myself. So if there is one thing that you really want people to take from National Immunization Awareness Week, what would that one thing be?
I think just that vaccines have changed the landscape of child health. Having your child fully vaccinated, including with the COVID-19 vaccine, if they're eligible, is critical to protecting them. It's like the seatbelt or the helmet. These things, they might be rare outcomes, but when they happen to you, they're 100%. We have a safe alternative. Vaccines are, like I said, in my view, the most probably important thing we've done in science. And I just really encourage people, make it a priority, make sure your child's up to date with their shots, and you as an adult as well. And that's a great way to protect ourselves and our communities.
Oh, thank you very much. I really loved this discussion. For everybody who joined, thank you so much for joining us. We're going to put a recording up on our page if you missed any part of it or if you want to share it with people. If we didn't get around to your question, you can leave a comment or you can send us a private message or you can email us at info@scienceupfirst.com. Also, if you have feedback or if you have anybody specific who you really think that we should chat with on another Coffee Up First, love to hear it. You can follow us on Instagram, Twitter, Facebook, and TikTok at Science Up First, and en français at La Science d'abord. You can follow Dr. Smart, her personal account at Katharine Smart on Instagram and Twitter, and at CMA_docs for the Canadian Medical Association. Is there anything else that you want to throw out there before we wrap this up?
Just thanks to everyone who came, and just thanks to all the Canadians who have supported us so much in the medical community and in healthcare over the last months. That support has meant a ton. So thank you.
Yeah, thank you so much, everybody, and I hope you have a great rest of your day. Bye.
Bye.